Talking today about teeth whitening. Who needs it?
My favorite topic.
Oh, good.
Well, need, that's it's mostly want, not need for whitening. It's the most asked for procedure in dentistry, in all of dentistry. And there's some misinformation out there. And so it's I think this is an opportunity to help clear some of that up. And
good.
I'd say one of the biggest questions, most frequently asked questions I get is it safe?
Right.
And I always like to tell the patient the origin of tooth whitening.
Yeah, that's what we were hoping to go into.
Yes, and it started with gum and bone research for health of gum. And there was a doctor almost 50 years ago that took hydrogen peroxide and baking soda and had his gum patients brush with that. And not only did their gums improve, but their teeth whitened. And
nice.
we figured out it was the hydrogen peroxide, and that was the beginning. That was the birth of whitening.
Was it the beginning of toothpaste as well?
No. We've had toothpaste, but the hydrogen peroxide. And so nowadays we use a formulation of that called carbamide peroxide. And the whitening agents obviously have developed every year since its birth. So yes, it's safe. It came from ways to help improve oral health. And actually still today when we whiten somebody, their gum tissue. I've worked every position in the office. I've been a dental assistant, I've been a hygienist, and now a dentist. And it's made me a better caregiver on every level for my patients. One of the things I think I've learned over the years is where to put my technology money. You can buy the latest and greatest and it sit on a shelf, or you can figure out within your practice what's going to make the patient experience better. My practice offers several cosmetic procedures that are enhancing smiles with whitening, with Invisalign, the invisible braces, with porcelain work. So we see people's lives improve when we give them a beautiful smile. That's rewarding. The latest and greatest tool I have that keeps me excited is probably the Invisalign, invisible braces. It has allowed me to evolve my practice into a philosophy of move it, don't remove it. In other words, where I was before I had that tool, move it where I want it instead of putting something on top of it. Staying involved in dentistry on every level, local, state, and national, makes me a better dentist for my patients. I would hope that my patients would feel that from that phone call, even that initial phone call, all the way through to the end of their experience, that it was the best care they've gotten ever. When a patient, especially a very nervous patient with some dental anxiety, when they send their friends and family to us, then we know we've done a good job. That's the biggest compliment we can receive. Our patients are our life and our livelihood, and we appreciate every single patient that walks in that door. And these are our family, and we treat them that way.
You can become a published author. Discover a system that will lead you from idea to having your book on the bookshelves. Bob Baer pulls back the curtain at the More Power to Publish workshop. Watch and learn how to follow the step-by-step plan to turn your idea into a published book. Learn more at morepowertopublish.com.